Hello everyone, and welcome to the YouTube channel for medical practice, Dr. John's Best Health. I am Dr. Chinwe John, and I'm a board-certified medical doctor in the field of physical medicine and rehabilitation. Today, we will be speaking about a condition called hypermobile variant of Ehlers Danlos Syndrome. Ehlers Danlos Syndrome is a group of medical conditions which all have disorders, that is problems, involving the connective tissue, specifically collagen. We have collagen in various parts of our bodies. Most commonly, you will know that we have collagen in our joints, but we also have it in our eyes, and we have it in the valves of our heart. So when a person has Ehlers Danlos syndrome, they can have problems in varying organs and varying parts of the body, including the skin, because we have collagen in our skin. Interestingly enough, the version we are speaking about, which is the hypermobile Ehlers Danlos syndrome, doesn't at this time have any genetic marker that has been identified. That means if you want to diagnose hypermobile Ehlers Danlos syndrome, you cannot do a genetic test that will show you a mutation in a particular gene whereby you will say, aha, this is the hypermobile Ehlers Danlos syndrome variant. Today, I'll be helping you answer the question, how can I know if I have Ehlers Danlos syndrome hypermobile variant, especially as it is the only variant of Ehlers Danlos syndrome which doesn't have a genetic marker that has been identified at this time to help you diagnose it through genetic testing. The reason why I chose to talk about this topic, Ehlers Danlos syndrome hypermobile variant, today is because I find it to be a condition that seems to be missed often, or maybe even misdiagnosed. In my field, physical medicine and rehabilitation, we do come across people who have Ehlers Danlos syndrome quite frequently, and so most people don't come to see me saying, oh, can you help me diagnose Ehlers Danlos syndrome, or I think I have Ehlers Danlos syndrome. I've actually never had anyone come to me saying that. When people come to me, they are coming to me usually because they're having chronic pain. Most of the people that have ended up diagnosing with Ehlers Danlos syndrome, the hypermobile variant, have been in pain for a very long time and never knew that they had this condition. So not exclusively, but typically, what I come across is this. Someone comes, they are very concerned because they've been having chronic pain for a long time. They have some diagnoses like arthritis, they have sprains, they have scoliosis, they might even have slip discs in their spine, and they come with this picture, fibromyalgia and having pain. And as you ask questions, and I ask particular questions when I suspect a person may have Ehlers Danlos syndrome, usually the questions aren't asked at the very beginning of the encounter because we're usually pursuing some other condition, and then the person will say certain things. Like if I ask, for example, when you were younger, did you play sports? They will say, yes, actually I was very athletic. Or they might say, yes, I was a gymnast or I was a dancer. And then from there, I ask questions such as, well, did you sprain your ankle a lot if you were playing soccer? And a lot of the time, I get a positive response. Yes, I sprained my ankle a lot when I was a child. Or they'll say, I always roll my ankle rolls in a lot. And I move on and ask questions about flexibility. And they will tell me they were dancers and they used to be very athletic, and then they had an injury which never really got better. Sometimes they ended up using pain medicines and now are trying to come off using those pain medicines. They're no longer as active physically as they used to be. And this is the sort of story that I usually get. And after asking more questions and of course doing a physical exam, I then let the person know that actually all these symptoms you have are all linked together. Another symptom which people often bring up is the fact that they get lightheaded easily or they faint, especially when they change position from lying down or sitting down to standing. And this indeed is linked to a condition that is commonly called POTS, P-O-T-S, and stands for Postural Orthostatic Tachycardia Syndrome. And this is a syndrome that occurs when a person's blood pressure drops more than what would normally be expected when they change position. And it's a problem coming from the autonomic nervous system. And it's linked with Ehlers Danlos Syndrome hypermobile variants, in the sense that people who have Hypermobile Ehlers Danlos Syndrome, which I will abbreviate as EDS, Hypermobile EDS, have a higher frequency of POTS. There is also another condition which occurs frequently in people with hypermobile EDS, but not as frequently as POTS, at least not in my observation. And this is mast cell activation syndrome. And this is a syndrome where a person's immune system, the mast cells, are more easily activated, and so they keep having these immune reactions which will manifest in the form of hives or sensitivity and intolerance to foods and chemicals. If you are someone who is very flexible and you're often having to crack your neck and you find yourself cracking your knuckles, and when you play sports you're rolling your ankle in a lot, or you find that you bruise easily, it's worth seeing a medical doctor, such as a doctor in the field of physical medicine and rehabilitation, or any specialist who is familiar with Ehlers Danlos syndrome variants, and checking to see if you have this condition, especially if you're having pain. Because if you get the diagnosis on time, there are certain steps and measures that you can take and that can be implemented to reduce the potential damage to your body over time. So our bones are held together in our bodies by ligaments, what they call ligaments. Ligaments connect bone to bone. Your bones are connected to your muscles by tendons. If you have repeated injuries to your ligaments, the ligaments are made of collagen, and collagen is stretchy. But as it stretches, if you keep stretching and stretching it, then its tensile strength gets less, and that's what happens to people who have Ehlers Danlos syndrome hypermobile variant. They can either have injuries to the ligaments, or you could have a complete tear of your ligaments, and then that puts you in line to keep having repeated joint injuries and increase pressure and force on your joints, and then that in turn leads to developing arthritis. Now, one thing is, when I'm speaking to an older person who I end up diagnosing with Ehlers Danlos syndrome hypermobile variants, I don't really expect them to have the sort of flexibility that a younger person or someone who has just started out having injuries from EDS. This is to caution you against putting all the emphasis of the diagnosis just on a scale like the Baton scale. So that particular scale to measure to see if a person may have hypermobile EDS involves hyperextension of the fifth digit, being able to flex your wrist and touch the side of your thumb, to your lateral forearm, and then stretching out your arm palm up and having hyperextension at your elbow joints more than 10 degrees, and then standing with your feet apart and having your knees bend backwards, that's hyperextend more than 10 degrees, and then also standing upright and bending forward from the waist and being able to have your palms flat on the floor. So it's not just being able to touch your toes, but you can actually place your palms flat on the floor in front of you. So these are the different measurements that are used for that Baton scale. But there's more to it. I find that people with hypermobile EDS may complain of shoulder subluxations or outright dislocations, or they will complain of their hip popping in and out of place. So hypermobile EDS, the diagnosis is truly going to be one that's clinical. There isn't going to be a test that will tell you, oh yes, you have hypermobile EDS, because it's the one form of EDS whereby there isn't any genetic marker available at this time to lend you that diagnosis. What do we do in this practice if we do diagnose someone with having Ehlers Danlos Syndrome hypermobile variant? If they insist on pursuing that sport, then they want to protect themselves. You could do kinesiology taping, taping or wrapping the joints. You would want to strengthen your muscles, doing more of isometric exercises, more so than isotonic exercises. Well, the first thing I do is to educate the person. And usually people are relieved, actually, because there's nothing worse than having a problem and not quite being able to figure out what is wrong. So what are some of the things that I offer or do in my practice to someone who has hypermobile EDS? Well, education on biomechanics, the importance of proper posture, the importance of not putting too much stress on your joints. Now, this will become very tricky when you're dealing with a younger person who is athletic, because remember, a lot of people who have hypermobile EDS will be either gymnasts or ballet dancers, and these are sports which are often very competitive and where people have to push themselves beyond their comfort zone. And so pain is often just accepted as being part of training and part of what it takes to be an elite athlete. So you do have to educate the person and caution them against damaging their ligaments and then subsequently damaging their joints. There are certain sports which, if possible, I would recommend someone with hypermobile EDS does not pursue if it's possible. Isometric exercises are when you exercise a muscle but without moving the joints that the muscle goes across. Scoliosis is quite commonly observed in my practice in people who have hypermobile EDS. And scoliosis of your spine, especially your lumbar lower spine, more often than not will lead you to have asymmetry of your pelvis. And when your pelvis is asymmetric, you end up putting more pressure on one side of your body and one side of your hip when you are walking, and this in turn can set you off to getting increased injury to your lower back and to your SI joints and to your hips as well, and even your knees. So you see, we are aligned in a certain way, and when one side of you is offset, it throws many things off. Based on the particular patient, particular exercises, particular lifestyle changes, and biomechanic recommendations will be made. If it's a person who is an adult and has children, you can advise them to check to see if any of their children are also hypermobile. So this way you can implement preventative measures while the child is still young. We've come to the end of this short discussion on hypermobile Ehlers Danlos Syndrome, and the emphasis was, well, how do I know if I may have it or if I do have it? And I've emphasized that this is a clinical diagnosis, that there isn't any genetic marker presently that has been identified that would help you diagnose by genetic testing alone whether you have hypermobile Ehlers Danlos Syndrome. It's a clinical diagnosis, and I shared with you certain features that are seen commonly in Ehlers Danlos Syndrome hypermobile variants, and I went beyond the Baton scale and mentioned shoulder dislocations and hip dislocations as being things that you should watch out for. Now, I hope that this video may give some reassurance to someone, especially if you've just been diagnosed with having hypermobile EDS, to know that there are some preventative measures that can be taken to reduce or even mitigate injury to your joints and ligaments But the first thing to have, of course, is knowledge, to know that you have this condition, and to know that with this condition, you have an increased predisposition to having injuries to your ligaments and your joints, so you can take certain precautions, even if you are an athlete. And if you're someone who has had a diagnosis of hypermobile EDS for a while, or you've always suspected that you have it, I also hope you may have some reassurance in knowing that, yes, you are right, that you do have this condition, and there are things that can be done to help certain problems that are brought about by having this condition. And if you have features of POTS and you think you may have POTS, I recommend you discuss this with your primary care doctor. And if you have a cardiologist, you can have a tilt table test and have these things actually diagnosed. Mast cell activation syndrome is also another condition that is seen commonly in people with hypermobile EDS. So please, if you've enjoyed this video, if you found it useful, please share it with someone else, and also consider subscribing to our channel, Dr. John's Best Health. We're a new channel, but not a new practice. And if you subscribe, you'll be kept up to date with any new videos that we put out. I look forward to assisting you. Thank you for watching, and stay well.